Hi, this is your Houston chiropractor, Dr. Gregory Johnson, and we have Teak here with us today, who flew all the way down here with his beautiful wife from New Jersey. Teak has had the unfortunate experience of having spinal fusion with instrumentation at 3 levels, L4, L5, and then all the way into the sacrum. And as a result of that, he has developed some significant scar tissue and adhesions around that area that I believe are actually in the neural sleeve. The nerves go through a little sleeve, kind of like a piston goes up and down in the sleeve of the cylinder. And when you get that fibrotic scar tissue and adhesions forming around that nerve and adhering it to the sleeve, every time you move or sneeze or cough, you get tremendous pain, and you're having a hard time with your flexion range of motion. And this is your 3rd treatment here so far, and we've pulled him the first 2 days, and he's got some really sore iliac crest from where the pins are, so I'm not going to pull him today, but you can't actually pull someone with hardware in there because those are fused completely, so those move as a unit. But I am adjusting his SI joints bilaterally as well as his L3 vertebra, because you can only adjust above and below that. You can't adjust the fused area. It all moves as one unit. So we're going to show you how we do that today. Let's check your posture out here first, T. I'm going to have you flex your head forward and then backwards for me. And then back to neutral. Yep. Now you can see he's got a little bit of forward head posture, and his gaze is kind of going down that way. So he's flexed forward on the x-axis here, and he's also translated forward on the z-axis, and he's translated to the right on the x-axis. His left shoulder's a little higher, his right arm looks a little longer. It's not really, it just looks that way. And his pelvis has translated to the left on the x-axis as well. So when we're adjusting him, so go ahead and come over here on your tummy next, Teak. When we're adjusting him, you'll see me putting him in a mirror image of that. Yeah, we'll go ahead and lay on your tummy. He's actually getting up and down better than you were the first day anyway. And the first day, his leg was a 1/2 inch shorter. Right now, it's exactly even. And when I bring it up, it stays even, and it starts hurting about right there. Right?
Yes.
Sore?
Yes.
Yep, but your knees aren't popping as loud.
No.
So you can see his pelvis raise up there. He still does have a positive knockless test, no Deerfield because his leg wasn't short. But he can tell he's got pain here in the SI joint, so he's translated left. So see, what I'm going to do is move him exactly in a mirror image of that, a little bit more over to the right. And then I'm going to adjust his SI joint on the right in the 45-degree plane that it's in. Because he's got so much scar tissue proliferation, we may not be able to get rid of all of that in the short amount of time that he's here in Houston. So we're going to recommend that he get a Pro 2 high-frequency vibration device that he can actually use on that scar tissue at home and start continuing to break that up. Now, I'm up here at L3 right now. There. Okay. And L2. And all these are going to be a little sore. And I am doing some lateral oblique stretches. And see, just doing that smarts and hurts because we're stretching those tissues out, and the nerves, they get stretched too. And if you got scar tissue surrounding them in the sleeves, that makes it even worse. So rapid release technology has a high frequency, high-speed vibration device that helps break up fibrotic adhesions and scar tissue. And he's been getting that from his chiropractor up in New Jersey, but he might as well just get one, and him and his wife can do that at home too, save him some money in the long run. And the scar tissue may heal up with a little less fibrotic adhesions on the nerve sleeve. I'm sorry.
That's alright. That's alright.
We're getting these paraspinals here, and you can see this is right at L5, S1, and it's very sore. Scar tissue is much more painful than normal uninjured tissue. Word of advice for those of you who are considering surgery, that even when they say it is low or less invasive surgery, there's really no such thing as a minimally invasive surgery. And I'll let Teak tell you about that himself afterwards. He's supposed to be in the hospital for a day, right? And then he ended up being in there for 5 days, and they had to go back in and do another surgery after that one. So he's actually had 2 back surgeries now. And chances are, if we could have gotten to him before he had those surgeries, we could have saved him from getting under the knife altogether. But a lot of people are told that surgery is the only option that they have, and that that's the answer, is they're going to feel better afterwards. And unfortunately, many people turn out just like Teak, and they still have the same problem, if not worse, than it was even before the surgery. And I'll again let him expand on that on his own afterwards. So I'm going to do a little bit of the high frequency on him right now over that area. But I'm also going to be doing it over the SI joint, because the SI joint we can still move, and we want to keep that mobile. So you notice that runs at a 45-degree angle down here. And then the sacrum right in the center here. And then the left SI here at the 45-degree angle down this way. I'm using the flat portion of the head on him now, the more diffuse part of the head of the rapid release Pro 2 model. But it has several different contact points and heads that you can use on it to be more specific. But I can tell you, he will notice an immediate difference from the flat heads here to, for instance, this one.
Yeah.
Feel that a lot more, don't you?
Yeah.
It's probably a little more tender, but it still really gets in the paraspinal tissues and deep vibration. So this may, over time, help reduce some of the neural scarring that he has taken place. And this is really the only option that he has other than going back in and having the surgery, which is not, you can't really get rid of scar tissue by going in and cutting tissues and creating more scar tissue. So that's not really a good, viable alternative. And I don't think he's really ready for another back surgery anyway. I'll let him tell you that. We do, in fact, refer patients to a very specific neurosurgeon here in Houston that's excellent. We sent several patients over there for surgical consults, and what I like about him is if he thinks the person's better off continuing with conservative care, he'll tell them to do that rather than jumping into surgery. So we like that about him. But we do send people out if they have spinal canal stenosis or spurs sticking into the spinal cord, or degenerative disc disease that's so bad that you're basically almost bone on bone. You're never really bone on bone, but the disc can get very thin and osteoarthritic. Now see, I'm using a kind of a flatter head now, but it's still more focused and concentrated than the big head you see, the green one there. You should feel almost a little heat sensation deep down in your tissues when we're doing this, too. Probably feel a little kind of like pins and pricks going on right at the surface. But this is soothing and helpful, and especially when you do it daily over a period of time, and even multiple times a day. So they've made a very long trip to come here from New Jersey, and you know, we tell people if we can help them or if we can't, and I've been real frank with Teak in saying that if we didn't have an improvement in his flexion and extension range of motion with less pain by Friday, that this is really not what's going to help him, and I would just encourage him to do this kind of therapy at home, and getting some deep soft tissue therapy or massage therapy would also probably benefit him. Which we have a full-time massage therapist coming in with us on the 11th of January, and we've got doubled our space here next door. We have another doctor that's joining us. He should be starting within the next couple of days. We're still getting the facility prepared for him. And we want to give a shout out to all our friends in St. Thomas watching. Anthony, Beverly. This is what we do here in the office. Now, I didn't decompress him today, but you can see that on the earlier video that I will be uploading today. And Anthony, I'll upload your final video later on too for people to see. Haven't had time to do that. We've been super busy when we got back in the office. That's why we didn't make a video the first day back. Okay. So, let's go ahead and let me put your head down just a little bit here, Teak. If you can scoot up in there just a tad. There you go. And let me get these mid-thoracics and upper thoracics still. Yep, perfect. And we want to keep his entire rest of his spine mobile and moving so that that scar tissue doesn't continue to go upwards. And you notice that down in here, it's even already starting to proliferate down into his lower thoracics and upper lumbars. Oh yeah, excellent. Boy, oh boy, I know you felt those. Yeah. Good job. Okay, let's turn you on your back now. That should be easier on your back than the other way. I know how bad he's hurting. I have not had back surgery or neck surgery, although they've recommended it several times. I have stuck with exactly the type of treatment that you see me doing in here, and I have always pulled out of it. They wanted to do back surgery, neck surgery, knee surgeries on both knees. You know, if you've got an MRI that shows a herniated disc, that's basically a license for any orthopedic or neurosurgeon to get the insurance company to approve surgery, and that's what they go off of. So let me help you up sideways here, Teak. We'll kind of swing. There you go. Good. Okay, let me adjust your shoulders here. There. Yep. Good. Yep. There we go. Good. And movement is still the key for him to continue doing some rehab and exercise. Swimming, Tai Chi is something I've recommended for him to get into to breathe properly and increase his movement with his chi energy. Okay, Teak, would you mind sharing your story with our YouTube subscribers?
Sure.
and your visit here, what brought you here, and how it's been since, and I know we haven't gotten rid of your problem completely, but if you can just tell them what you've experienced here. And
Sure. I've had two herniated discs for like 12 years, decided to get surgery. Got the first surgery, there was a complication, then I had to get a second surgery, and it took a lot of time for me to heal to a point where I could even like get off my walker. I was on that for 4 months and the cane for 3 months. And then I've tried all kinds of therapies and medical treatments, from acupuncture to injections, 3 different types. None of that helped, and I started to go to my chiropractor where I live, and it really didn't help so much. And then we found Dr. Johnson. My wife did. God bless it, she did, because it's my pain has gone down slightly in my first couple of visits, which is better than I was when I got here. I know I have a long road to go, and I'm going to continue to do what he's telling me to do, and hopefully I'll get better.
And just to let people know out there, they told you this was a minimally invasive surgery, right?
I would not recommend surgery. I would try all other conservative forms of medication first,
or chiropractic
treatments, things like this, because I regret it. Honestly, I do. I regret it. It's been the worst year of my life.
And it was quote unquote minimally invasive.
Minimally invasive spinal fusion.
Right. See, and people think that that's like a microscopic kind of thing, but I can tell you from being in on surgeries, they got their pliers and cutters and head clippers out, and they're cutting tissue. And anytime you cut tissue, you're going to have scar tissue development. It's an inevitable thing. So I just wanted to thank you, Teak, for sharing your story.
Thank you for your help.
Well, thank you. We've been doing everything we can to help him, but there's certain limitations to some things you can help, and we're going to be honest with our patients and tell them what we can and can't do, and we're going to get as far as we can get with him here in the time that we have with him, and send him home with some instructions to help himself, and go from there. And we're going to pray for his healing every day as well. So this is your Houston chiropractor, Dr. Gregory Johnson and Teak, coming to you from Advanced Chiropractic Relief in Houston, Texas. We'll see you next time.